Well, good afternoon, everyone. We are so excited that you are here. This is the fifth, I can't believe it, Tom, the fifth National Health and Productivity Forum that has been put on by the Integrated Benefits Institute and Tom Parry, the great leader of IBI, and the National Business Coalition on Health, the organization that I run out of Washington, D.C. It is exciting that you're all here. It seems like yesterday, Tom, that you came to me with the idea of putting this national forum together, and it's been a delight to work with you and your staff. My job at the beginning of this conference is to thank everyone. I want to first start with the great staffs of IBI and NBCH. By the way, there's a little echo. Do people hear it? I hear it.
Just us.
Just us, okay. But I want to thank all the staffs of IBI and NBCH. It's been a labor of love to really put this conference together. I also want to thank the co-host of this conference, the great NBCH member coalition in this region, led by Marianne Faison with the Dallas-Fort Worth Business Group on Health, and I want Marianne to please get to know Marianne and her member employers over the next couple of years, and if you want hints on where to go in this great city, Marianne's the source of all information there. I also want to thank the great sponsors. They'll be flashing up on the screen periodically. We could not do this conference without your generous support. I also want to take the time to thank the great faculty that's been assembled, and particularly IBI's team in putting the program agenda together. And we truly think this is going to be a great learning experience for you. And finally, I do want to thank you in the audience. It is really a testimony to you and your commitment to health and productivity movement that you're all here, and we very much appreciate your presence. And we certainly hope as part of this conference that in coming together, you can learn from one another. I think one of the most exciting things that both of our organizations try to do is to network and build learning communities among employers, among coalitions, so we can take the best practice strategies and spread them as best we can. And certainly it goes without saying that truly this conference is dedicated to all the employers that I think in incredibly difficult times have been dedicated to this movement of health and productivity and human capital. You think of the external environment over the last couple of years with, of course, the Great Recession, with the imposition of the healthcare reform law that will create new mandates and expectations of employers. You are being asked to do more with less. And in this environment that you're still investing in health and productivity as a strategy that is critical to your business objectives, I think is again a great testament to your commitment. So again, this conference is dedicated to all the employers in the room that continue to toil in this field. So with that, I'm going to turn it over to my partner in crime, Tom Parry, to say a few opening remarks, and then we're going to move into our award presentation. Tom?
Andy always gets to go first, you know, and there's not much more to say after Andy has said his piece. It's very eloquent. It's really a pleasure. I've been doing this now for 17 years. It's hard to believe that this is our 17th Health and Productivity Conference from IBI's standpoint, and the 5th with NBCH. And it just gets better and better. And I think it gets better and better because the issues become more and more important. I think employers across the board understand that the health of their workforce and it's important to their business is far more than just the cost of healthcare. And I think to that extent, employers are looking for new ideas, new solutions, and that's what brings everyone here today. It's not vendors and employers. It is people looking for solutions to the absolutely critical issue of healthcare in the U.S. and everything that flows from healthcare. That is absence and performance and disability and all the like, and ultimately business. So I commend you for attending. I look forward to being able to have a chance to meet and discuss the issues with you over the next couple days. It's a pleasure to be here. Mary Ann, let me add my thanks to you for working with us in the local area to help host this meeting. Now, just a couple of housekeeping items. We did something new this year. You know, and I don't know about you, but when I go to conferences and I look at the attendee list, and of course, almost the first thing you do is look at the attendee list. And I always see people that I want to meet. But, you know, walking around looking at people's name tags is really kind of a hard thing to do. So what we've done this year is we have this application, which actually allows you to sign in, put your information in it, and actually connect with people that are here at the conference that you might not know, or you kind of forgot how to put the name with the face. I'm sure all of us can relate to that. So I want to make sure you go into the application, you download it, and you can do it on your iPhones or your Android phones by going to the App Store or whatever, putting in HP Forum 13 or HP Forum 2013 and download the app, put in your information. The agenda's there, the meeting rooms, about the Dallas area. It's really a great thing, great addition. And as I say, we really want people to connect. One of the reasons we don't have an exhibit hall is we want to spend as much time as we can outside the sessions really connecting together and having those conversations that we all want to have. So make sure you sign into the app, download it, put your information in, and so we can all connect together. If you'd like to tweet about your experiences at the conference, please use the hashtag HPForum. You can find out what people are saying about their experience here. So let me turn now to really a wonderful part of the program, and that's the Annual Health and Productivity Award. It's presented to an employer that has demonstrated leadership in the area of health and productivity by working with its employees to develop and implement and measure, and I always underscore measure, innovative approaches to managing health and productivity. And I have to admit, even 5 years ago, it was really hard to find employers that were really on the cutting edge. And today, employers everywhere are on the cutting edge. And it gets harder and harder, just as it gets harder and harder to select the speakers for the conference. It gets harder and harder to find and select one employer among all employers that's doing a superb job at managing health and productivity. I would like to thank Johnson & Johnson Healthcare Systems and Ethicon Endosurgery for their support for the Health and Productivity Award. And with that, let me turn it over back to Andy Weber to present the award, and then we'll get on with our program for today. Andy.
Thank you. So this is our Oscar moment, of course. Who watched the Oscars last night? Raise your hand. The envelope, please. So I'm very pleased and honored to announce that the winner this year of our Healthy Workforce Productivity Award is Kraft Foods Group. And I'm going to ask Kathy Alpine, Senior Director of Kraft Foods Group, to come up on stage together with Cheryl Larson, who is with the Midwest Business Group on Health. Kraft is a member of the Midwest Business Group on Health, and I want them both to say a few words. While they're coming to the stage, let me just say a few words about the wonderful record of Kraft Foods. Again, as a company overview, Kraft Foods is North America's 4th largest packaged food and beverage company. I of course, know them for Kraft's. I grew up on Velveeta cheese and grilled cheese as a family. So again, I'm very excited to honor Kraft today. I lived on that stuff. But in terms of their health and productivity initiative, in 2010, Kraft implemented an integrated health and productivity strategy in partnership with Aetna. And I think that partnership between a company and an insurance company as a major vendor is critical to the success of a program. And by the way, you can hear about their experience, both Kraft working with Aetna tomorrow afternoon, where Kathy will be presenting with a senior official from Aetna as well, so please come. But some of the key features of the program included an integrated customer service and care management program providing member-specific, holistic solutions. Very importantly, in fact, you don't win this award without quantifiable impact on healthcare costs, population health and productivity, targeted outreach and support driven by a robust population health data. Another key feature, a high deductible health plan and health savings account, surcharges for non-participation in health management, and incentives, very importantly, incentives for taking steps to manage and improve health. Now, I won't go into all the wonderful results that Kraft has achieved over this time period, but let me just mention a few things that certainly jumped out of the page and their application for me. Number one, medical trend, 8.8% in 2009, down to 1.2% in 2012. Member satisfaction up to 95%. HR completion, health risk assessment completion, from a starting point of 39% in 2009, immediately jumped to almost 100% over the last 3 years, and probably something to do with incentives in the program as well. I was most impressed with, and a theme that we hear at this conference every year, is the difficult task of engagement. How do we get more people engaged? And we're putting together so many wonderful programs, but so often people are not coming to the table, if you will. And again, a statistic that flew off the page for me was that a nurse-engaged disease management program for the top 5 conditions moved from 16% participation and engagement to 77%. A just unbelievable jump. Anyway, I won't go through all the results. Again, if you want to hear more about the details, the strategy, the lessons learned, I asked you to go to Kathy's presentation tomorrow afternoon. And at this point, I simply want to again acknowledge Kathy and acknowledge Kraft Foods. And before I actually present her the award, I want Cheryl Larson to say a few words. Cheryl?
Thank you, Andy. Thank you, Andy. Ooh, it's loud. Sorry about that. I am really honored to be here, to be part of providing or giving this award to Kraft Foods and Kathy McAlpine. Kathy has worked tirelessly in working with benefit plan design, on wellness, on productivity. She's got a staff that supports her. They have worked so hard, especially in recent years, to focus on some of the things that Andy just shared with us. Kraft has been a long-standing member of the Midwest Business Group on Health, and we are just proud to be here today to be part of this award ceremony. Kathy, come give us your thoughts and congratulations. Oh, that's right, Andy, you get to do that.
Well, I get to actually present this Oscar award that we have. It's actually a beautiful presentation. So, Kathy,
beautiful. Thank you so much.
Here you are.
Can you all read that?
Please.
I am truly honored to receive this award for Kraft. Kraft has been, the commitment to employees' health and their families' health has really been longstanding. I've been with Kraft 10 years, and when I came in, they had a very robust wellness program. So this strategy was really just a continuation or further commitment to that program. And it's just gratifying to be able to really see the fact that you're improving the health of your population. At the same time, we're managing costs, and when you talk about managing costs, everybody thinks about managing costs for the employer. And that's important. We're a business, we have shareholders. All of our employees are owners of a company, so that's important. But for all of us here, I think we're always concerned about making sure care is affordable and accessible to all of our employees. So we're really probably most proud of the fact that we're actually managing the cost for our employees. So when you do things like this kind of a strategy, you don't do it alone. So we had a partner who had the same passion and commitment that we did, and that partner was Aetna. So Aetna, we were partners, true partners, which means you can't throw each other under the bus. And we did not, and we had a lot of challenges, and we had some ups and downs, but I will say that we absolutely could not have done this without Aetna's innovation and flexibility. And so I was telling a colleague, I'm going to say flexibility in the same word with an insurance company, and I know that I don't want to offend anyone, but that doesn't happen that often. So a huge thanks to Aetna. And then just finally, I will say that this is not an easy strategy. I know a lot of us are sharing the same way of trying to engage our population, truly improve the health, and then manage these costs. And a lot of us have been doing it for a lot of years. But when you engage in a strategy like this, you're really changing almost the contract, the partnership that you have with your employees and your service providers, and even your administrators. So it's really important to understand that change takes a while, not get frustrated, but yet just it works. And hopefully some of you will come to the session tomorrow and I can show you at least our early results. We've got a long way to go, but truly excited about the possibilities, and want to thank you all and thank the IBI for honoring Kraft in this way, because it's really validating and to have this kind of award. So thank you.
There's a nice little
Thank you.
box for it.
I don't want to trip down the stairs.
One more housekeeping item that I did forget is there will be a drawing for a $250 gift certificate, but you have to be here to win at the end of the conference. So I wanted to remind people about that.